Assalamualaikum. My name is Noor Suraiya binti Rahim, and today I will present about my case study. During my internship, I got two case study. First, anemia in pregnancy. Second, underweight in children. Okay, for the case study, I will using SOAP assessment. Okay, SOAP assessment stand for subjective, objective assessment and plan. Okay, so for the case study one, the patient name is Naziha. Her gender is girl, and he is referred to nutritionist due to anemia in pregnancy, and she claimed that she have irregular meal time. Okay, for the SOAP assessment, subjective. Okay, she is 20 years old. Uh, the patient had one children and pregnant with second child. Okay, so the patient is in her 28 weeks and have excessive gestational weight gain. Her BMI before pregnancy was normal. Okay, so her appetite was in control. However, she always feeling hungry, especially during afternoon and midnight. Okay, so she also comply hematinic zinc copper. Okay, so for the objective, as we can look here, uh, her hemoglobin uh, was 10.9 and increased to 11, but keep decreasing when 16 week and 19 week. Okay, for her weight, during 20 weeks, her weight was 53, while for the 24 week, her weight was 56.5 kilogram, which means for a week, the increasing of weight was 0.875, which is quite not normal. Okay, so for the objective is to increase the hemoglobin above than 11 and maintain it until deliver. Second, to control the weight of the pregnant mother to prevent excessive weight gain. Okay. Okay, so for the assessment, the patient have irregular meal time, high sugar and fat diet intake, low iron, folic acid, and B12 diet, and also have low vegetable intake and iron inhibitor intake without gap with hematinic zinc copper and main meal. Okay, so the patient also have inactive lifestyle. Okay, so for the plan, we suggest her to do um, active physically, practice healthy meal plan, uh, having gap between Milo and FCM 2 hours before and after main meal, and hematinic zinc copper. Also, practice vegetable for 3 serving per day, and increasing iron, folic acid, B12 in her diet, and also reduce sugar and fat in her diet, and also having regular meal time. Okay, for the TCA, is 32 week, which is I can attend their appointment because I have done my internship at KK Marang. Okay, so for the menu plan, breakfast is whole meal bun, papaya, plain water. For the morning tea, full cream milk, cream cracker biscuit, white red rice, meat soup, watermelon, stir fried vegetables, plain water. For the afternoon tea, kuih kasturi, and plain water. For the dinner, white rice, fried chicken, vegetable soup, papaya, plain water, and for the supper is low fat meat. Okay, for the discussion and conclusion. Discussion. Undiagnosed and untreated uh, iron deficiency can have a great impact on maternal and fetal health. Indeed, chronic iron deficiency can affect the general well-being of the mother and leads to fatty and reduced working capacity. There is also evidence that suggests to a significant correlation between the severity of anemia, premature birth and low birth weight, intra- intrauterine growth restriction, low neonatal iron status, preeclampsia, and postpartum hemorrhage, similarly to what occurs for other pregnancy-related disease. Okay, so for the conclusion, healthy eating should be practiced by the mother for the health of the baby in the future. Mother should follow the recommendation from the nutritionist and doctor in order to increase her HB level and maintain weight gain. Okay, so for the case study 2, Afia. She is a girl and referred to nutritionist due to underweight gain and stunted. Okay, she is a food basket receiver, which is food basket package 13 that receive multivitamins, called emulsions, medium chain triglycerol or MCT, and pediatrial milk. Okay, so for the SOAP assessment, subjective. Okay, the patient was 1 years 11 months. Okay, weight for age is 7.4 kg, which is KBBT, kurang berat badan teruk, and length for age is 74 cm, which is bantuk teruk, and her BMI is 13.5 kg. Okay, which means categorized as underweight. Okay, so her bowel movement and past urine was okay, and she also have well appetite and also healthy and active, and patient stay with her grandmothers and auntie and other siblings. Okay, so the objective is to ensure the children consume enough energy intake of 900 until 1000 kilocalorie per day and manage to have weight gain with nutritious food. Okay, so for the assessment, her energy intake based on the diet record was 915 kilocalorie and protein intake was 30 gram, and uh, their hygiene was moderate, and also improper preparation of pediatrial that lead to the tendency of incorrect portion of pediatrial, because based on my observation, the mother prepare the meat, she put the meat first, and after that she pour the water. So this is the incorrect way to prepare the meat. Okay, so next, the basic facilities was available, and inaccessibility of basic home food such as eggs, fish, chicken, and others. Okay, so um, the fully use of pediatric and multivitamin, and mother claims that the meat that supplies was not sufficient, one ten only for 2 weeks, and need to buy other meat uh, with their own money because they have no sufficient of milk supply. Okay, so for the plan is energy recommend is 900 to 1000 kilocalorie per day and continue pediatrial supply to give MCT all 1 ml for each pediatrial feeding, which is 5 times per day, and to prepare correct portion of pediatrial water first for us, then 3 scoop of pediatrial. Okay, for the to come again is 22 April. Okay, so next, okay, for the menu plan. For the breakfast, she can have 1 glass of meat, 1 slice of bread, with teaspoon of margarine. For the morning tea, they have can half slice papaya, 2 pieces of biscuits, and 1 glass milk-based drink. Okay, for the lunch, 1 cup white rice added with 1.5 tablespoons cooking oil, um, 1 ikan kembung, okay, 1 cup spinach, and 1 glass plain water, and also 1 banana. Okay, for the dinner, she can have 1 cup of fried meat, also added with 1.5 tablespoons cooking oil, with half cup vegetables and half slice papaya, with 1 glass plain water, and for the supper, 1 glass full milk cream. Okay, for the discussion and conclusion. Okay, discussion. Children who are underweight, also known as low weight for age, weight less than a healthy weight nourished youngster of the same age. This could be because to the child's inability to grow in height, weight, or both, or because he or she has lately lost weight. Okay, so infants' cognitive development may be influenced by stunting, a kind of chronic undernutrition, and a bad family environment. Intervention to prevent malnutrition should begin during pregnancy, and caregivers should be educated about their duties in providing cognitive stimulation for their children at home. Okay, so for the conclusions, parents must be alert to their child's development from birth, and parents should be cooperate with nutritionists in overcoming their child's disability, which are stunted and underweight. Also, creative and interesting foods need to be created to interest the child to eat. So I think that's all from me. Thank you.